Hi, Rob MacIsaac here, and I'm here with...
Hi, I'm Alim. I'm one of the emergency physicians at the Hamilton Health Sciences. I work at the Hamilton General, the Juravinski and McMaster Children's Hospital, and I'm also the site chief for the Hamilton General Emerge.
And today we're going to talk about 3 things you should know about emergency departments here at Hamilton Health Sciences.
So I think the first thing you should know is the emergency departments in Hamilton, and most emergency departments are divided into 3 major areas. The first area is the major area or resuscitation area. It's where we put our sickest patients. It's the patients who need either close monitoring or need life-saving interventions. The second area is the observation area. These are patients who are still quite sick, but who don't require the level of monitoring or care as they do in the major area. The other area where most people generally see the emergency department is our rapid assessment zone or minor area. We probably put about 60 to 70% of our patients through that area. Those are patients who need assessment, who need usually some degree of treatment, but who are generally able to walk on their own, who are relatively stable, but still need to be assessed and cared for in a particular area.
So those trauma patients are probably, always prioritized, and maybe you could talk a little bit about how do we prioritize patients in the ED? Who gets served first, and why do some people have to wait?
For sure, it's a great question. So in the emergency department, patients are seen in order of how unwell they are. So, when you come into the emergency department, the first person you're going to see is one of our expert triage nurses. They see patients, they ask you a little bit about why you're there, a little bit about your past medical history, and then they assign what's called a triage score to you, or a CTAS score. The CTAS score helps us determine how unwell a patient is. So a patient might be a CTAS 1, which means that they need a physician and a nurse at the bedside immediately, and we bring them right in. A CTAS 2 is what's called emergent, so someone who needs to be seen quickly, but not as fast as a CTAS 1. CTAS 3s, which make up the bulk of the patients who come in, are urgent. So patients who require an urgent assessment but don't necessarily need to come in as quickly as the first 2. And then CTAS 4s and 5s are semi-urgent and non-urgent.
You talked a little bit about our expert triage nurses. And I think, as with any part of the hospital, healthcare is such a team sport. Can you talk a little bit about, who are all the people involved in helping the ED to function well? What are all the various specialties?
In the emergency department, we have a group of expert nurses, physicians who work in the emergency department, respiratory therapists, social workers, EAs, porters. If you look outside the emergency department, we also have medical radiation technologists, ultrasonographers, as well as if you're, say, at McMaster, we have child life specialists. And then we have a large group of consulting services that help us: internal medicine, general surgery, orthopedics, pharmacists, medical laboratory technologists who help us process all of the blood work and things that we do in the emerge.
And of course, lots of great administrative support.
Absolutely. Another really important thing to know about the emergency department is that the Hamilton Health Sciences is a teaching hospital, so we have a large number of learners in the emerge. So we have students from a number of disciplines. So we have nursing students who come through the emergency department, as well as medical students who all rotate through the emerge.
Must be a really interesting job. Sickness is a great leveler in many respects in our society, even though, we see disproportionate amounts of illness between populations, but everybody gets sick, and probably everybody at least once in their life has to come to the ED, so you must meet people from all walks of life.
For sure. And so, the emergency department is always open. We're a 24/7, 365 operation, and we're here to care for people at their time of need. And we take care of people from all walks of life, and certainly we are always happy to do so.
Yeah, great. Thanks, Alim.
Thank you very much, Rob.
Well, I really enjoyed talking to Dr. Alim today here at Hamilton General in the ED. So the 3 things you should know about emergency departments across Hamilton Health Sciences. First, they're structured into various areas depending on the nature of sickness that the patient is coping with. So the second thing is that patients are categorized according to how sick they are. And the sickest patients are taken care of first, so that makes lots of sense. But in order to take care of all those patients, we have this unbelievably skilled and diverse team of people all coming together to provide the right care. The last thing you should know is that there are a lot of learners constantly working in our emergency department They are for sure part of what makes the emergency department work, but at the same time, it also helps us to fulfill our mission as a teaching hospital. Thanks to Dr. Alim and thanks to all the staff and our EDs for all the hard work that they do. Cheers.